The function of kidneys is vital for general wellness, as they filter the blood, remove wastes, balance the fluids, and maintain normal electrolyte levels. In this video, we will tell you the symptoms and signs of kidney problems. Let's get started. Fatigue and weakness. Unusual fatigue, even after rest, is one of the most frequently reported symptoms of kidney failure. This may occur because wastes are not being excreted effectively by the kidneys, and that might lead to a toxic buildup that causes tiredness. Swollen feet and ankles. The leg and foot swelling, referred to as edema, is one more symptom of kidney failure. The swelling of the lower extremities is due to the inability of the kidneys to eliminate excess water from the body. Nausea and vomiting. Waste. Accumulation in the blood occurs due to renal failure and can cause nausea and vomiting. This is a consequence of inadequate waste filtering functioning of the kidneys, which can lead to a variety of gastrointestinal specifics. If you haven't already, subscribe to our channel for weekly updates on everything related to health and food. Pain in the back or flank back or side discomfort that could be a kidney stone or infection showing symptoms is another potential kidney problem. This pain is similar to a burning sensation and may spread to the lower stomach or the groin region. Changes in urination. Alterations in the amount, color, or sound of the urine, such as frothy urine or the inability to empty the bladder, can suggest kidney problems. Foaming urine is often a sign of proteinuria, which is observed in early kidney disease. These symptoms are not always very obvious and appear gradually with time. That is why it is important to be on alert and to see the doctor if these symptoms do not go away or worsen. Those who suffer from kidney problems have far better prospects if the disease is detected and treated early. Less obvious signs of kidney problems. Kidney failure often comes with various skin issues like rashes and itching, as excess waste products and toxins accumulate in the blood, causing skin irritation and inflammation. Repeated scratches can cause the skin to be damaged. The symptoms include shortness of breath, pulmonary edema, dizziness, lightheadedness, chest pain, and pericardial effusion. These are common in people with kidney disease. Energy imbalances such as sodium and potassium, which can lead to dizziness, lightheadedness, or muscle cramps, can be the causes. Pericardial effusion, the aggravating factor, can result in chest pain and discomfort. Dysgeusia, i.e., the metallic flavor in the mouth, can also be an indication of kidney failure. Excessive substances in the blood result from bad kidney function, changing taste receptors in the mouth. And finally, a persistent metallic or bitter taste is always there. These symptoms may appear to differ in severity and may not be always observed in the earlier stages of the kidney disease. Seeing the care provider regularly and having the kidney function checked will help to detect and manage renal problems in good time. It is indispensable to have routine visits with a healthcare provider and to pay attention to kidney function to diagnose and treat kidney complications early on. Risk factors for kidney problems. Here are all the significant risk factors for kidney disease. Diabetes. Diabetes has become the largest risk associated with kidney disease and the original cause of most cases of kidney failure. Sugar, which comes from diabetes, hurts kidneys, and their ability to filter waste or fluid from blood by urine production becomes weak. Factors such as this may be the reason that kidney disease develops over some time. Proper diabetes care substantially reduces the chance of developing the extreme stage of kidney disease. High blood pressure. One other leading cause of kidney disease is high blood pressure, with it being the second most common factor of kidney failure, apart from diabetes. Elevated blood pressure can frustrate blood transportation in tiny vessels in the kidney, which are likely to cause damage. High blood pressure can also be an early manifestation of kidney disease. controlling your blood pressure can prevent the development of kidney disease or help hold it off. Family history. Having parents, grandparents, or siblings who have kidney disease is the main risk factor, which is likely to also lead to kidney diseases. People often inherit kidney disease, and in case your close relative has kidney disease, you may be much likely to have it too. Age. The renal function would start declining with age as normal. Along with aging, kidneys start to become less efficient, which may lead to such diseases as kidney disease or obesity. The higher the level of obesity or overweight is, the higher the risk of kidney disease. Obesity is a high risk factor for chronic kidney disease, and both diabetes and high blood pressure are the two most common causes of the disease. This implies that the most dangerous situation for you is being obese, because it doubles your risk of kidney disease. It is vital to understand such risk factors and take adequate measures to manage them to minimize the risk of this kind of condition in the future. Routine health screen checks of kidney function and timely visits to the healthcare provider are vital for the prevention and management of renal problems. What to do if you're experiencing symptoms? Kidney health is a serious issue, and it should be addressed proactively by taking necessary actions to ensure good health status. It is essential to get the medical services of a doctor for proper diagnosis, since kidney problems can manifest themselves in many ways, including tiredness, swollen feet, changes in the urine, and skin problems. Routine kidney function testing and damage checking are of great importance in the surveillance of kidneys, since it ensures the detection of abnormalities as early as possible, implying an effective and timely treatment. Achieving lifestyle changes is one of the most effective ways to avoid kidney problems, but also to preserve kidney health. These changes will include consuming a diet low in sodium, potassium, phosphorus, and calcium, exercising regularly, enough sleep, weight management, stress reduction, and avoiding tobacco products. Through making these lifestyle changes, you can reduce your risk of developing kidney issues, manage current conditions like high blood pressure and diabetes, and improve the function of your kidneys generally. Regular checkups, being informed about kidney health, and following the doctor's advice also can significantly contribute to the prevention of kidney disease and the maintenance of healthy kidneys. Conclusion: identifying kidney signs and symptoms is crucial for proper diagnosis and management of kidney problems. Regular checkups, testing for kidney function and damage, and lifestyle changes are essential steps in prioritizing kidney health. Proactive measures can prevent or delay the progression of kidney disease, enhancing quality of life. Prioritizing kidney health is not only important for individuals, but also for society, as it can lead to significant healthcare costs and reduced productivity. Thank you so much for joining. If you enjoyed the video, don't forget to give it a thumbs up and subscribe to the channel for more content. I'll see you in the next video.